everyone to this evening's session, Oral Health and Aging, presented by Dr. Marsha Straker, who will tell you a little bit about herself a little later on. It is a rainy evening, and we thank all of you for joining us. Just a couple of housekeeping rules this evening. We're asking you to please keep your devices muted at all times. There will be a question and answer session at the end, and we ask that you use the raise hand icon if you have a question, and you can also place your questions in the chat. But other than that, please stay unmuted. Stay muted, sorry. At this time, I will hand you over to BARP's president, Ms. Marilyn Rice-Bowen, who will give you some opening remarks.
Thank you very much, Judith. And I'm greeting all on a rainy evening. So because it's rainy, it's cool, on a cool evening. I want to acknowledge members of the board and our CEO. And of course, very important, we want to extend a very special welcome to Dr. Marsha Straker, who is our presenter for this evening. BARP's theme, we continue to explore topics against the backdrop of our theme, which is Healthy Aging, Aging Strong. And when we were approached by Dr. Straker to address the matter of oral health and aging, it seemed like so far-fetched, oral health and aging? Where's the link? So I recognize that members are still joining, but we are so eager to hear about this link because we've been socializing to believing if your hand hurting is a hand. If your foot hurting, if you're having stomach problems, something wrong with the stomach. So to hear that there is indeed a link between your oral health and your physical health and oral health and aging, this evening's presentation, Dr. Straker, we are eagerly looking forward to it. And as Judith said earlier, you will share a little bit of your background with us, but I want to welcome you on behalf of the Board of Management and Board of Directors, Management and Staff of BARP, and of course, our BARP members here this evening. A warm welcome to you, and we are looking forward to a very enlightening presentation on oral health and aging.
Well, thank you so much for that warm Bajan welcome on such a cool evening. I want to say that it certainly is a privilege to be here, to be able to speak about oral health and aging. The presentation will be an interactive presentation. So in a bit, we're going to go right into the presentation. I want to make sure that everyone knows that I am pleased to be here with regards to BARP. I know that BARP has younger members and not so young members, but what is important is that oral health affects us all. So whether we have real teeth or we use oral prosthetic rehabilitation devices, so that's a big term to say artificial teeth. So whether you have real teeth or mock teeth, oral health is important, dare I say vital. So without further ado, I'm going to go straight into the presentation. And I am going to be sharing my screen with you. Okay, so here we go. And as the title of the presentation states, we're talking about oral health and aging. And at this point, I would actually invite all of you, if you do have access to a handheld mirror or a pocket mirror, or even your phone camera, because there will be an interactive part during the presentation, because I like to be very hands-on and make sure that people understand what their mouth looks like and what is going on in their mouth. So if you can grab a handheld mirror, a pocket mirror, or even use your phone camera, it is going to make the session a bit more interactive. So a little bit about me. I graduated from Sapienza University of Rome, which is in Italy, with a degree in dentistry and dental prosthetics. I do have a master's in advanced oral surgery, and because I loved my university so much, I decided to do my PhD. My PhD is probably in the longest titled PhD in the world. I'm doing a PhD in innovative technologies and diseases of the skeleton, skin, and oral facial district. part of my, let's say, learning process was to do internships on the wards of periodontology, oral surgery, public dentistry, and my favorite ward, which is geriatric dentistry, I was able to do an internship for 2 years. At this point, I'm actually going to turn off my video so you don't get distracted by actually my face. So you'll concentrate a bit more on the presentation. Okay, so when we think about dentistry, some of us have a very, I would say, antiquated notion about dentistry. We think about pain. We think about blood everywhere for some reason. We think about oversized needles, which is definitely not true. And we think of probably what is every dentist's worst nightmare: patients holding on to our hands as we try to perform our procedures. I cannot tell you how many times I've broken out in cold sweats, seeing the side of a patient's hand coming towards me during a procedure. So please absolutely do not do this. So we want to move from this aspect of dentistry to our more modern approach to dentistry. So here we have a patient who is looking calm and relaxed. She's probably undergoing conscious sedation. You can speak to your dentist about that procedure. This is a procedure we use for our more anxious patients. So there really is no excuse not to go to the dentist in this modern day. We have the use of technology. So this is an electric toothbrush, which is connected to an app, which allows you to see how long you've been brushing for, the pressure that you're using, and your other oral hygiene, for example, applications that you may need to use. And of course, we move directly into teledentistry, which is the modern evolution. In certain cases, we want that certain patients, maybe patients who have mobility issues, who may not be able to come into the dentist, for certain routine checkups, they can stay in their home and they can actually talk to me or any other dental professional, and we can actually do the checkup directly in their home. So this is something that maybe as a country we could begin to look at as we move towards a more aged population. Okay, just seem to be having a bit of it. Okay, so what should you remember your take-home message, even though this is at the beginning? First of all, oral health is not just about teeth. Prevention is better than cure. This is an old adage that all of us know about. And oral health is important to general health. And what this presentation will do is that it will allow you to understand from each aspect what I am speaking about. So I like to lay the foundation for people to understand better about their oral health. So when we speak about oral health, as I mentioned, we don't always want to talk about teeth, but teeth are very important. And it is important that people understand how many teeth are supposed to be in your mouth and the function of these teeth. So in this picture, we have a lovely senior lady with a beautiful smile. And next to her, we have an x-ray. Now, this is not her x-ray. This is an x-ray of one of my younger patients. And I'm using it to show you, for example, that each tooth has a function. And so in this area, we have the anterior teeth. So these are going to be your incisors. We see those usually when people smile. These are going to be your canines. And we move towards the back of the mouth, going towards our premolars and our molars. So it's important to remember that each tooth has a particular function, and that function is determined by its form and position in your mouth. So besides the teeth, then we have the tongue. This is the point where you should get your mirror, your camera. And what I want you to do is to actually open your mouth and look at your tongue. You can stick out your tongue. You don't need to use your hands, because unless your hands have been washed, please do not put your hands in your mouth. So look at your tongue, stick out your tongue, look at it. What color is it? What shape is it? And what is also an important aspect is to be able to look under the tongue. So what you're going to do is that you're going to take the tip of your tongue and you're going to put that on the roof of your mouth, and you're going to be able to inspect, for example, underneath the tongue. And why is this important? Because we're going to see later in the presentation that quite a few oral diseases are actually diagnosed from what is going on underneath the tongue. Most of us are not going to look underneath our tongue, but it is something that we should begin to practice in the mirror to know what a healthy tongue looks like. So we move on to gums. So with regards to the gums, obviously we are people of color, and sometimes we have melanin deposited in the gums, which make them darker than the traditional pink color. That is normal anatomy. There is nothing wrong with your gums. If they're a bit darker than, let's say, another person, that's normal. That's melanin. And that's a normal aspect. This is a normal aspect to melanated gums. Gums should not be puffy, they shouldn't be red, and there certainly should be no signs of bleeding. While in this photo, we have the traditional, let's say our traditional image of what gums should look like. But I think this is important for us as people of color to recognize that this does not represent that you have a disease. This is normal anatomy. I too also have darker gums. Another aspect is obviously the oral mucosa. I'm just talking about the inside of the cheek. This is also very overlooked. You should know what your inside of the cheek looks like. So you can also look at that in the mirror right now. Sometimes people actually have birthmarks on the inside of the cheeks, and they can actually think that it's a lesion that they should be concerned about, but you need to know what your normal anatomy looks like. The lips. Some people would ask, well, what does dentistry have to do with the lips? But for us, we also are looking at the lips because we want the lips to be able to close fully. And what we're also looking for is, for example, if there's any cracking on the side of the lips, and if there are any lesions that might occur actually on the surface of the lips, so herpetic lesions, et cetera, et cetera. So look at your lips now, the shape, the form. I'm sure they're absolutely beautiful. But again, you definitely need to know what your natural lips look like so that you would be able to identify any pathological process that may be going on. This is an often overlooked and not known part of the oral system, and this is called the temporomandibular joint. None of us pronounce this entire word all day. We just say the TMJ. And this is a joint which is located right in front of your earlobe. So sometimes when people are saying, oh, I have an earache, it actually is because the joint is having a bit of difficulty. And what does this joint do? This joint allows us to open our mouth. It allows us, for example, to chew, it allows us to speak, and it is actually the most commonly used joint in the body. So picture that. People think of the elbow and the knee, but it is actually the most used joint in the body. And so we can imagine we all have that friend who continually talks and talks and talks. And so they're using this joint quite a bit. So what is going to happen is that in people who have dysfunction of that joint, you can have headache, you can have shoulder pain, you can have neck pain, you can have, for example, something that resembles a very bad earache. You can actually even have ringing in the ear. So we actually want our patients during their 6-month checkup to let us know if they're having any problems in that particular area. So this, for example, is what the TMJ allows us to do. So the TMJ allows us to open our mouth. It allows us to move the mandible from side to side. And this will allow us to speak, to chew, and to do all of the functions which allow oral health to be a part of general health. So good oral health, what does it allow us to do? It allows us to speak. It allows us to chew. It is an important part of our facial expressions. It allows us to swallow, and it allows us to taste. So the teeth are necessary for the pronunciation of certain sounds. So this is going to be a very interactive part because I want people to understand how important the teeth are so that when we get to tooth loss, we want to allow you to understand why you should not lose your teeth, why you should do everything possible to keep your natural teeth in your mouth for as long as possible. So for example, certain sounds such as throat. Now this TH sound for us Bajans usually becomes a tr sound. That's just Bajan vernacular. So this TH sound we know should be pronounced as throat or 3. So that's the number 3, not the plant that grows outside called tree. This is pronounced 3 or throat. So you can pronounce this word in front of the mirror now. So throat. The next sound The next sound is going to be the V sound, which is called, for example, we use in the word very. And when you say it slowly, we can see how the lips are going to be interacting with your teeth at the top. So we can say very. The F and the S sounds, I want to make special note for the denture wearers. Now, these particular sounds are extremely difficult to pronounce when you're first fitted with your dentures. Some people, unfortunately, never get accustomed to pronouncing those sounds, and you might hear a whistling, or they might try to pronounce the word in a different way. But if you say foul and saw, those are very important sounds that need to be made using the teeth, the tongue, and actually your lips also. And of course, the last sound, which we definitely need our teeth to pronounce, is the Z sound, so in zone. So we have throat, very, foul, saw, and zone. So here's a little practice exercise. I like to make sure that it's interactive. So in this practice exercise, we're going to go through, I'm only going to go through the first part. And what you can do is look into the mirror as you're pronouncing the words. We're going to pronounce these words together. This is also a handy exercise for any denture wearers who still might be a bit uncomfortable with certain sounds. You can practice in the mirror twice a day, and I guarantee you that it will get better. If you feel anxious as you're about to pronounce these words, denture wearers, what you can do is that you can close your mouth, swallow, and that actually repositions the denture in the correct place. So here we go all together. I hope you have your mirror, your pocket mirror, or your cell phone camera, and we are doing this together. Tiny, tasted, very little treats. So we go again. Tiny, tasted, very little treats. And again, obviously, when we're looking at very, we see how the lip must, for example, be in contact with the upper teeth in order to pronounce that sound very. So of course, at your pleasure, you can pronounce fair is foul and foul is fair. That definitely will get your mouth going. And of course, Sister Sue sews shirts and shorts. Would not like to pronounce that 10 times quickly, but I'm just going to go through it once again. Sister Sue sews shirts and shorts. So again, these are exercises not so much for the natural teeth people, but for the artificial teeth. Sometimes it's a bit difficult to pronounce, but I promise if you practice, it will get better if you do have a bit of anxiety in pronouncing certain words. So this is a video. Well, this lady needs to have her teeth cleaned a bit. She has some food in her teeth, but I want you to look at how the tongue is interacting with the teeth and how the lips are also interacting. So this is how we are able to speak, and it is important that we're able to use all of these different aspects and that these different aspects remain healthy. And we can ensure that these remain healthy by going to our dentist. So remember, I said speaking, chewing, facial expressions, swallowing, and tasting are all aspects that good oral health allows us to do. And here we have a lovely young lady. And what is this young lady showing us? Well, first of all, she's showing us that she seems to be eating a fig. So this is a European fig, not a Bajan fig, but some form of dried fruit. And we see her, for example, she's using her front teeth to tear the food. The tongue will then be used to push the food to the back with the molars and the premolars, and she will finish off by chewing and grinding that food before swallowing. Now, all of us know someone, or we ourselves are guilty of shoving food into the back of our mouth. We don't even bother to tear it. This is not how you are supposed to use your mouth. Your mouth has teeth with different functions, and specifically for our more elderly participants, where the risk of choking becomes a bit higher, you definitely need to make sure that your food is properly ground before you swallow it. So just a bit of a quiz. I always like a little bit of a quiz sometimes when I'm teaching the students to make sure that they're alert. So when should I go to the dentist? Should I only go to the dentist when my teeth are hurting? Should I only go to the dentist when my breath smells bad? Should I go to the dentist every 6 months? Or should I only go to the dentist when I start losing teeth? Of course, I would assume that all of us know that we should be visiting the dentist regardless of whether we have real teeth or mock teeth. You should be visiting your dentist every 6 months. So getting into the meat of the matter, so we laid the foundation, we have our skeleton, so now we're going to put some meat on the bones. So aging and oral health, what are some of the challenges that we, all of us, are going to encounter as we age, and what our mouth may experience? So one of the factors that increases as we age is periodontal and gum disease. Additionally, certain forms of oral cancer, the probability of us developing these will increase as we age. Dental decay, and specifically, I'll show you which type of cavity increases, the probability increases of developing which type of cavity as we age, and dry mouth. Now, it's important to note that dry mouth isn't just because you get old, absolutely not. Dry mouth occurs because as we age, sometimes comorbidities means that we're taking certain medications. Some of us, unfortunately, may have other systemic issues which may contribute to dry mouth, and we'll go through those in a bit. All of these factors can lead, if untreated, to edentulism. So this is just a big word to explain tooth loss. Edentulism means tooth loss. So all of these factors we need to prevent to avoid us losing our teeth. So we start with periodontal or gum disease. So what happens in gum disease? What do we notice in someone that has gum disease? I must indicate that gum disease is very subtle. It occurs usually with very minimal or no pain. So it's very subtle, and it's one of the reasons that you really should visit your dentist every 6 months, because you may not even realize that you have it. So we see gums that bleed easily. So sometimes when you're flossing or brushing your teeth, you may realize that there's a lot of blood forming. Sometimes the gum disease is so bad that some people actually wake up in the morning with blood on their pillow, and that's actually coming from their teeth. And so we want people to be able to go to the dentist. The teeth actually become shaky. And the problem is that the teeth are becoming shaky without any pain. For some reason, they say, oh, but you know, doctor, all of a sudden I realized that when I try to bite something hard, you know, my molar is just rocking a bit. And that is usually an indication of late stage gum disease. So if left untreated, it does lead to tooth loss. And some of the causes include poor oral hygiene. So for example, the plaque and not brushing your teeth properly, not flossing. Smoking is also one of the factors. Thankfully, in Barbados, we don't have that big of an issue with smoking of tobacco. There's still certain studies that need to be done with regards to other vegetable products which may be smoked. In terms of genetics, some people just have a predisposition. So think about in your family, did my granny have issues like this? Did her teeth just follow all of a sudden? Is my mom having these types of issues? Then if you see that there's a familial pattern, you definitely should get yourself checked out. And in terms of diabetics, unfortunately, diabetes does increase your risk by 2 to 3 times of developing gum disease. So here we have a clinical presentation of gum disease. So we have blood around the teeth structure, and we can actually see that the gums are receding. It just means that the gums are actually moving away from their original point. And in the next slide, we have a severe form of gum disease. We can actually see this is actually plaque, which is still on the tooth. This person needs their teeth cleaned. And the formation of plaque is actually causing this inflammation that we're seeing around the gums. But for us as clinicians, what we use to, one of the factors we use to definitively diagnose gum disease is our x-ray. So this is the x-ray of my young patient. I'm not too sure how easy it is going to be for you to follow me, but I'm going to try my best. So what we're looking for here is the position of the bone. I want to just remind you that x-rays, we can only see hard tissue. I cannot see gum tissue in an x-ray. But what I do know is that gum follows bone. So if bone recedes, gum is also going to recede also. So following the cursor, this is what I'm looking at. This particular line here is where I'm looking at for the bone. Now, this is a relatively young patient. The wisdom teeth haven't completely come out. Actually, this wisdom tooth is probably going to have to be extracted. And at this point, this is a healthy mouth. Bone level is high. I'm just going to be a bit of yeah, this person has a bit of a cavity, I think, but anyway, I'll talk to them when I get back. And next to this person is a person with severe gum disease. In this case, so you're going to follow my cursor, you're going to see where the level of bone has gone down. So we see the bone is extremely low. It has reabsorbed, which is another big word, that the bone has disappeared. I can guarantee you that this tooth is just in the mouth. I don't know for what reason, but it really is holding on by a wing and a prayer. These are extremely shaky teeth. And unfortunately, in this case, this patient will probably have to get all of these bottom teeth extracted and get a rehabilitation, some form of prosthetic. They also have other issues. For example, this looks like an abscess, which is going on. They have roots which need to be removed. This is certainly not a good situation for oral health. But again, we're just using this to show you what gum disease looks like. We're looking at the bone recedes, and therefore you're left with these teeth which are shaking, which eventually either drop out on their own, or we have to extract them as dental professionals. So when I mentioned dental decay, I spoke about cavities. Specifically in elderly people, we're talking about root cavities. So particularly in this one, this is probably a cavity which is formed by the clasp of a denture. So those metal clasps, if they're not fitting properly, they tend to erode the root, leaving the dentin exposed, and which means that that is more susceptible to cavities. So definitely, if you are a denture wearer, a partial denture wearer, or you take care of someone who does wear partial dentures, you need to take note of these types of situations. These are also root cavities. These also happen due to diet, so drinking a lot of carbonated beverages, etc. And I have to say, these are very difficult types of cavities to treat for us, just because it's quite difficult to be able to place composite resin in this area of the mouth because of saliva and other factors. So this is really what we want to prevent. And I'm going to later on explain to you how this can be prevented. But definitely you should speak to your dentist as you begin to age in the different, for example, tools that can be used to prevent these forms of cavity. These forms of cavities are extremely painful sometimes. So we really want people to be able to get these treated, but more importantly, prevent them as quickly as possible. So we move on to dry mouth. Now, remember, as I said, dry mouth is just not a natural condition of aging. What does dry mouth do to your mouth? It makes you more susceptible to cavities forming. And this is because the reduced salivary flow means that we have less antimicrobial properties and the neutralizing effect against the acids. So here I have a list of the causes of dry mouth. So you will see that, for example, some of the side effects of some medications, medicines such as high blood pressure medications, cholesterol-lowering drugs, asthma meds, these can always cause dry mouth. Now, big, huge asterisks here, and hear me well. This is not an excuse for you to stop taking your medication because you heard a presentation from Dr. Straker and you think that your mouth is dry. Absolutely not. Before you stop any form of medication, you need to consult your doctor first. You can talk to them about dry mouth, but you should never stop your medication willy-nilly. With that being said, we see another cause is actually just certain diseases. So diabetes and HIV/AIDS. Unfortunately, oncological patients who undergo radiotherapy and chemo and immunotherapy, a lot of these drugs actually do cause dry mouth. And some individuals who do have diseases which cause nerve damage will be susceptible to dry mouth. Once again, you can speak to your dentist about the different aids that we use to treat dry mouth. It is certainly not a type of brown mint solution. We actually have medicines called artificial saliva. So you can actually speak to your dentist about these types of aids. So we move on to the clinical presentation of oral cancer. Remember, as I said, as we age, we are susceptible to certain forms of oral cancer. And I want to highlight this particular slide because we see that this looks innocuous. It doesn't look like some big bad form of cancer. It looks like sometimes maybe we ate a piece of bread and, you know, the bread left there over time. However, this is a pre-cancerous lesion, and just in case people are not oriented, these are the bottom teeth. This is the frenulum from the bottom of your tongue. So remember when I asked you to look in the mirror, put the tip of your tongue on the roof of your mouth. This is what I am going to see, and this is what you should be able to see in the mirror. This is an area where a lot of precancerous lesions form, so you should be able to know what your normal anatomy looks like. Unfortunately, in this case, these are not the same patients, but this is an example of what a cancerous lesion looks like. This particular instrument, they're just using it to measure in millimeters. And of course, this would have to be removed. So again, we want to make sure that in our young patients, but our not so young patients, we're definitely checking for oral cancers. Again, a lot of oral cancers do not have any form of pain or any form of, let's say, irritation. So that's what makes it so, for example, so problematic in diagnosing. So if you at home know what your natural anatomy looks like, it definitely helps because you can say, look, I have this lesion in my mouth, I have this spot in my mouth, I don't usually have it, it's not moving, I really should go to the dentist. So that definitely helps us also. So we move on. And all of the factors which I just described, we want to prevent edentulism, the big word for tooth loss. So we see in this particular patient what tooth loss she has had. She has had, for example, tooth loss in the upper anterior tooth. She doesn't seem to have any posterior teeth. And she has, for example, her anterior bottom teeth remaining. So some people would say, well, doctor, what's the problem? Just leave the teeth as they are. I don't really feel like doing anything with them. They're good there. The problem is that teeth move. It is not just in younger people, and the orthodontists are constantly fighting to move teeth. Teeth move on their own. And what happens is that when we have a tooth that is lost, for example, this tooth has been lost, this is going to be a molar. We see that the tooth at the top extrudes, so that just means it comes down. The teeth that are next to the space will try to fill that space. So what could happen is we have a situation where a premolar is performing the function of a molar. And as you remember, I said that each tooth has a particular function, form, and position in the mouth, right? So we're trying to prevent this. So this is an example of severe tooth loss. What happened here is that the canine has extruded because she does not have her bottom canine. These bottom teeth have extruded because she doesn't have any top teeth. Those little buttons, brown buttons you're seeing are actually roots that she needs to extract. And this is just a situation that we definitely want to avoid. This is a drastic situation, and we really want to avoid that. Tooth loss changes our facial appearance. So not only what's going on inside the mouth, but also what's going on outside of the mouth. So as we lose one tooth, we may not have a situation like this. We may still have a situation where, for example, the bone is supporting the facial features. As we progressively begin to lose teeth, and specifically as we lose teeth, the bone also is lost, we begin to get this typical almost witchy-like appearance where the lower third of the face becomes very concave, and we actually have a nose which appears longer. So this is a situation that we definitely will try to prevent, especially in our elderly patients. There really is no need in 2024 for this to occur now. So tooth loss does occur. Sometimes it occurs due to trauma. Sometimes it occurs due to reasons that are beyond our control. So what options do we have to replace those missing teeth? Well, the options that we have are removable complete dentures, our removable partial dentures, our fixed partial prosthesis, and our fixed complete prosthesis. And I'm going to go through each particular type with you. So if you don't wear dentures and you're not interested in this part, you can mute it for this part. But if you do, because, you know, all of us probably know someone that's missing denture, that's using dentures, so we could at least give them some information and tips. So I'm going to start first with the removable complete denture. That's a typical form of denture that we know. So in this case, we have a gentleman who has not yet put in his dentures. And we see how his face changes as he puts in first the upper dentures, and then he puts in the lower dentures. And look at how his face has changed. Look how happy he is. He's even given us a thumbs up sign. So this is important because from no teeth to now having teeth, these hopefully are functional dentures, not just pretty dentures, but they actually have a function allowing him to chew properly. Yeah. So we move on to the removable partial dentures. Now, these are dentures which have a type of clasp, whether that be a metal clasp. They also might have a male or female component, but they always have, for example, this metal bar for stability. This is the evolution of modern dentistry. This is called Valplast, and this allows the clasp to actually have the same color as the gums. So it is actually more aesthetically pleasing. This actual denture is a lot lighter, so it's more comfortable to wear. However, it is not as resistant as these dentures to wear and tear. So you may actually have to replace that a bit more often. And this right now is a bit more expensive. But obviously it is the more aesthetically pleasing options. Quite a few patients come in and they want this particular type of removable partial denture. So the other form of prosthetic rehabilitation is our fixed partial prosthesis, and these would be our bridges. The teeth that surround the tooth to be replaced need to be filed down, so they need to be prepared. That's the correct term. And then we put crowns on these teeth, which then are able to hold the tooth that we're trying to replace. So many people are comfortable with this solution. When we're talking about fixed prosthesis, these are prostheses that you cannot remove at home. You need to go to a dentist to get these removed and cleaned. So once again, every 6 months, you definitely should be going to your dentist. And finally, we have our fixed complete prosthesis. And these are implants. So this is an over-treatment. Nobody's going to be using hopefully, so many implants nowadays. And basically, we see the implant screw in the bone, and then we have the prosthetic put on top, which is going to replace our missing teeth. Again, this is an over-treatment because I know there's some dentists listening and they're like, oh, we don't do it like that. Yes, I know we don't do it like that. So normally we can use, for example, 1, 2, 3, 4 implants, and then use those 4 implants to complete our prosthesis. But this was just to show you that when we speak about fixed complete prosthesis, we're usually speaking about implants. So just another word on the implants. So we don't always have to use the implants to replace all of the missing teeth. You can actually use an implant to replace just a singular tooth or also multiple teeth. And it is a very viable option. One thing about implants is that because the implant stimulates bone growth, then you don't have to worry about bone being reabsorbed. Unfortunately for denture wearers, that is not the case. As you age and because you do not have any teeth or implant to replace the lost teeth, what happens is that the bone just disappears. And with the bone disappearing, you will need your denture to be, for example, remodeled at times. You may actually have to replace your denture over a number of years. So you definitely need to keep going to the dentist to make sure that your dentures are fitting properly. So these are conditions that can occur for denture wearers. I admonish denture wearers, but also individuals who are caring for individuals with dentures to be on the lookout for these denture sores. So what happens is that this is caused by ill-fitting dentures. Sometimes the clasp or even the actual acrylic material is not fitting properly, and it squeezes the soft tissue continually, and what we get therefore is a situation where eventually the soft tissue erodes and we get these painful type of ulcers within the mouth. So we definitely need to be on the lookout for those, especially in our not so young patients, diabetics, because of course, you know, diabetics and wound healing, definitely be on the lookout for this. So we move on to another condition called denture stomatitis, and this is caused by a fungal infection. And this is something that denture wearers may experience. This can occur due to constantly sleeping in dentures, not taking them out at night, not cleaning the gums and tongue, and also low immunity because it is an opportunistic infection. So regardless of the cause, you have to get this treated by a medical professional urgently. So as I said before, prevention is key. So your at-home oral hygiene is key to preventing many of the oral conditions mentioned before. But what I want to highlight, reiterate, is the amount of time engaged in appropriate home oral care. So it's not just taking out a toothbrush, brush, and then you're done. We're going to see what is the right amount of time and what is the right technique that we should be using at home. So this is particularly for our participants who have their natural teeth. Toothbrushing, everybody should know this. So recommended twice a day with fluoride toothpaste. Fluoride is an essential part of prevention of cavities. As we age, remember I said that you should speak to your dentist about particular aids. So actually in some cases, we may actually prescribe a toothpaste which has a higher content of fluoride for our elderly patients. You should be brushing for at least 2 minutes a day, 2 minutes each time of brushing, I'm sorry. In our pediatric patients, we let mommy and daddy put on a little tune, maybe from Peppa Pig, or I'm so old, I don't even know what are the other cartoons now. I still have Flintstones and Space Ghost Coast to Coast, so forgive me. So whatever cartoon or whatever, I don't know what, y'all can look at a YouTube podcast, y'all can look at, I don't know, something uplifting while y'all are brushing your teeth, but it should be for 2 minutes each time. Soft or medium bristled brush. There is no need for a hard bristled brush. For me, all hard bristled toothbrushes should be at Carter's because the only thing you should be doing with those is scraping paint. People who use hard bristled toothbrushes literally damage the enamel of their teeth and additionally their gums. So please use a soft or medium bristled toothbrush. If you find, for example, and you come to me and say, but doctor, I don't find that I'm getting all the plaque off, it is usually your technique. So we're going to go through a bit about the proper technique. Yeah, that's going to be very important. So this, of course, is a pediatric patient, but we can all relate to this. And this is how we should be brushing. We should be brushing from pink to white. That's what we tell the children, from pink to white. So do not brush from the white to the pink, because it means that you're sending plaque into your gum, which is going to cause irritation of the gum. So again, the proper technique is to brush from your gums down to your teeth. Yes? Okay. So that's pretty easy to understand. What should we be using at home? So we can use our manual toothbrushes. As we age, some people may have difficulty with mobility, dexterity. So for my elderly patients, I will usually recommend an electric toothbrush. Please do not go out and say that Dr. Straker made me spend a whole set of money buying an electric toothbrush. Do not do it. A manual toothbrush is good enough once you're able to manipulate the toothbrush and remove the amount of plaque. Electric toothbrush, however, for people with dexterity problems is a viable option because, for example, you don't have to manipulate and use your hand in a way that can be painful. Some of us have arthritis. I say me too in that, unfortunately. So an electric toothbrush is a bit more comfortable to use, okay? So again, if you don't wear dentures and you're not interested in wearing dentures, you may want to mute this particular part, but this is specifically for the oral hygiene for denture wearers because we are at BARP. And what do you need? You need a denture brush. I know these are sold in Barbados. You need your denture cleaner. So this is a cleaner which you're going to soak your dentures in for about 3 minutes. And these should be obviously branded cleaners. So this is not something that you're mixing up in your basement. This is something you buy off the shelf, please. And again, if you don't have a denture brush, you should be using a soft bristle toothbrush, because what happens is that if you do use a hard bristle toothbrush, you run the risk of scratching the surface of the denture, and those micro cracks can actually allow bacteria to form, and they may actually make your denture a bit more uncomfortable to wear in certain cases. Yeah. So denture cleaning, again, I repeat, if you don't wear dentures, this part may be a bit boring for you, but I always believe that any bit of knowledge is good. So in denture cleaning, you need to clean your dentures over a bowl of water or a folded towel in case you drop them. Do not use toothpaste. Toothpaste usually contains some sort of abrasive agent, which may scratch the surface of the denture. You should be using the appropriate non-abrasive cleanser. So I just showed you one type. You don't need to go and buy Polydent. They're definitely different ones on the market, and you can definitely use those. Dentures should be cleaned at least twice a day, just like brushing normal teeth. And we highly recommend that you are able to remove them overnight. Now, I'm not too sure if we have any for example, people who take care, people who work in the geriatric homes, if we have any geriatric nurses. I know that sometimes some of the patients do not want to remove their dentures. I know that sometimes it can be a literal fight, but definitely removing the denture should be encouraged in all of the patients. So what do? We start by rinsing and brushing them under running water. Now, this should be cold water and not hot water. We should pay attention to the grooves where adhesive is used. We need to soak our dentures overnight in a small glass in the appropriate denture cleaning solution, not something that somebody mixed up for you. Appropriate denture cleaning solution. You should be using cold water. Hot water is actually going to change the acrylic material, and you can actually warp your dentures. So you definitely need to use cold water. The reason why dentures need to be soaked is to prevent them from drying out. And of course, in the morning, you always should rinse your dentures before putting them back in your mouth. So one important aspect, even if you're wearing removable dentures, you still need to brush any natural teeth that you have, and you need to brush your gums, tongue, and palate. The palate is the roof of the mouth once your dentures are removed. And once again, a soft bristled toothbrush. As I told you before, where I think hard bristled toothbrushes can go. Okay, so based on what you have seen before, I am going to let you imagine if you think I approve of the way this person is brushing. Now, I'm going to tell you what I like. I like that she seems to be using toothpaste. I hope it's not soap. So she's using toothpaste, so I like that. What I don't like is that she's very, very harsh with brushing. You don't need to be so harsh with your teeth and gums. Even though the teeth are hard, you can actually caress them. Again, it's the technique. Holding your toothbrush at a 45-degree angle and not just moving it around like if it is a paintbrush, a Harris paintbrush. We really need you to understand that the gums are delicate, the gums are sensitive, and we don't need you brushing them vigorously. This instead is what I like to see, gentleness. And she's moving from the pink area to the white area as we recommended. Yeah, you should be brushing your teeth in front of a mirror. I know a lot of us like to, maybe Netflix is on and we don't want to miss the show or something, but you really should be brushing your teeth in front of a mirror. I know it adds on to what you have to do at night, but you know, your teeth are going to stay with you or should be staying with you for the majority of your adult life. Okay, so flossing, here we have an elderly gentleman who is flossing his teeth. Now, I am a strong proponent of flossing. I really try to make sure that all my patients begin to floss in some way. I like his flossing technique, but however, he's not flossing between each tooth, and that is essential. You must floss between each particular tooth. And of course, flossing is going to get rid not just of food, but of course of the plaque which forms after we eat. Now, there's a train of thought that if I see blood, I should stop flossing. No, the blood is an indication that something is inflaming the gums. In most cases, it is the plaque that's inflaming the gums. So by continuing to floss, you will actually get a reduction in the bleeding. If it doesn't stop, I would say after about 2 weeks, this may be your indication to go in and see your dentist to find out actually what is going on. Again, in the elderly patients, sometimes the use of the hand may become a bit more difficult. So in those patients, I recommend using floss, for example, which actually has a handle attached to it. So in this case, you just move the floss in and out or up and down. The downside of this type of floss is that it cannot wrap around the tooth in certain areas. So each part of the tooth may not be flossed effectively, but again, it's better than nothing. And so if you realize that maybe you have an aunt or an uncle who's having difficulty flossing, this may be a better alternative. Of course, I want to introduce you to my lifelong friend, interdental brushes. Now, these are sold at IMAR. I checked. Okay, so don't tell me, Dr. Straker, we don't have those on the island. You do. They are in IMAR. They come in different sizes, and that's based on the color. And you use them simply by pushing them back and forth between the teeth. This is another alternative to flossing for individuals who may have difficulty with actually manipulating the floss around their fingers. So this is a very good option. Obviously, in the utopia of dentistry, we would want people to brush, floss, use interdental brushes, but we know that that is not a practical solution. So if you can use one, either use floss or use an interdental brush, and then you brush in the way and the technique that I explained before, I guarantee that your oral hygiene will definitely be much improved. Super Floss, this is a recent addition to the market, and this is specifically for, remember I speak about the fixed partial prosthetics like bridges or also these implants. So what Superfloss has is an end like the head of a needle, and basically you are able to thread that through, and the soft part of the floss is here, because if you look at normal floss, if you try to thread it under a tooth, it will just bend. So Superfloss actually has a pointed edge, and that allows you to get underneath the prosthetic